Hydronephrosis is a dilation of the width of the renal pelvis greater than 3 millimeters, not including the proximal ureter, due to obstruction of the accompanying ureter. This video is from an 11-year-old neutered male Sheltie with a tumor of the bladder obstructing the left ureter. With chronic hydronephrosis, there may be thinning or loss of the renal medulla and cortex. Pelvic diverticuli are extensions of the renal pelvis not normally seen on ultrasound unless the renal pelvis is moderately to severely dilated. Diverticuli of the renal pelvis are anechoic on ultrasound and do not show color with color flow Doppler. In this video from a 13-year-old cat, the renal pelvis and diverticuli are dilated. Dilation of the proximal ureter and renal pelvis usually suggest pyelonephritis, and antibiotic therapy is indicated. In acute or early infections, the proximal ureter may dilate before the renal pelvis does. Dilation of the ureter outside of the kidney suggests obstruction of the ureter and/or bladder. It is often possible to follow an obstructed ureter to the point of obstruction, either in the ureter or at the urinary bladder. This video is from a 12-year-old Labrador with a tumor of the bladder obstructing the left ureter. Ureteral obstruction may be caused by ureterolithiasis, purulent material, blood clots, stricture, tumors, or polyps. Cats with ureteroliths may show crouching, vomiting, anorexia, or hiding behavior. Some may show aggression. The ureters of a cat have a tiny lumen, 0.4 millimeters, and are easily obstructed by small stones. Movement or lodging of a ureterolith or rapid distension of a ureter can cause pain. Dogs with ureteroliths do not seem to show signs of pain like humans or cats. In one feline study, approximately 72% of cases of ureteral obstruction were due to ureteroliths. Approximately 98% of ureteroliths in cats are calcium oxalate stones. Another feline study in cats with ureteral obstruction showed that ureteral dilatation begins proximally at the kidney and extends distally toward the bladder over time. Ureteral dilation often does not extend to the obstructing calculi, which explains why the obstructing ureterolith is seldom seen on ultrasound. In addition, in cats the calculi are small and the ureter is surrounded by a layer of hyperechoic fat. Many ureteroliths will pass in time. Complete migration may take weeks or months. Approximately 30 to 40% of feline ureteroliths will spontaneously pass. Early and aggressive treatment of ureteral obstruction is recommended. Initially, fluid diuresis may help a stone to pass. In this video, a large stone is partially obstructing ureteral flow. Do you see the smooth, rhythmic contractions of the ureter? The presence of contractions indicates that the ureter is still functioning. A study of normal dogs after ureteral obstruction showed a decrease in renal blood flow to 40% of normal in the first 24 hours of ureteral obstruction and a further reduction to 20% of normal after 2 weeks of ureteral obstruction. In human medicine, a surgeon may intervene if there is no movement of a ureterolith in 3 days. Ureteral lithotripsy, or surgical removal, shows more favorable results in dogs than in cats. Placement of a ureteral stent may also be possible. In this patient, a tumor of the trigon of the urinary bladder is obstructing the ureter. Any cyst in a young bull terrier, Persian cat, or Himalayan cat indicates congenital polycystic kidney disease, or PKD. PKD only affects about 6% of all cats, but may affect 37 to 50% of Persians and related breeds. PKD progresses slowly as portions of the medulla and cortex are replaced by cysts and renal function decreases. Cysts may also develop in the liver and pancreas. PKD does not cause systemic hypertension in cats as it does in dogs and humans. The rate and progression of renal disease is variable. Acquired cysts indicate current or previous renal damage, most commonly resulting from infection. Renal cysts have thin walls and anechoic contents on ultrasound. If gain is increased, the cortex and medulla show increased echogenicity, but the cyst contents remain anechoic because the cyst contains nothing to reflect the ultrasound beam. Acquired cyst may result from intraluminal tubular obstruction caused by inflammatory debris or extraluminal compression of the tubules by parenchymal inflammation or fibrosis. Cysts can occur in the cortex or medulla and are usually benign and inactive. The presence of a dilated pelvis supports infection as the cause of the cyst. Cysts should not be biopsied or aspirated unless an abscess or neoplasia is suspected. The biopsy needle should pass through renal cortex to help prevent urine leakage. The cyst shown here could be aspirated by passing the needle through renal cortex. A cyst like this one, that extends outside of the renal cortex, should not be aspirated. If the cyst contents are not anechoic, if the cyst walls are thick, or if the cyst contains internal septations, consider other abnormalities such as abscess or neoplasia. On ultrasound, a renal pseudocyst shows the entire kidney to be surrounded by anechoic fluid contained by a thin membrane. Pseudocysts are uncommon in cats and rare in dogs. They are called pseudocysts because they are not lined by epithelium. Pseudocyst may result from trauma, perirenal fat necrosis, neoplasia, or may be idiopathic. The most common owner complaint is abnormal enlargement of the abdomen, and veterinarians may palpate an abdominal mass. The distended renal capsule may interfere with blood flow to the kidney, resulting in elevated systemic blood pressure. Draining fluid from the pseudocyst immediately relieves the systemic hypertension. The type of fluid aspirated from the cyst will indicate the treatment needed. If the creatinine and potassium of the aspirated fluid is higher than serum creatinine and potassium, the fluid is due to urine leakage and the kidney should be surgically removed. If the aspirated fluid is a transudate, the fluid of the pseudocyst can be totally aspirated. The membrane of the pseudocyst can be surgically removed, or the membrane can undergo surgical fenestration with or without omentalization.